wait for Epifania later in the presentation, in the agenda. Um, so it's 5:05. Um, so it's 5:05. Welcome to everyone to the Health and Human Services Committee meeting of February of this of this year, 2021. Yes.
Very loud.
I'm sorry.
Can everybody mute themselves, please? When it's your turn to speak, you can turn the mic back on. There's a lot of background noise. Luke, I apologize for that.
Oh, and now it's silence. Okay, so everyone, welcome everyone. Thank you for coming and being here once again from far away, but closer to far, to our Health and Human Services Committee. I think everybody has received the agenda. We just went through the agenda. I understand one of the guests is not here yet. However, we're just going to proceed, and once she join us, we can, we can have her doing the presentation. But before we start, I just want to make sure.
They joined us. Adams.
Oh.
Mr. Adams is on.
Okay, good. So, but before we start, I just want to the board members to identify who are here, so the presenters know who we are. I'm Luis Marrero. I'm the chair of the Health Committee.
Hi, this is Julia Cruz. I'm the Director of Social Services, and also I'm the first Vice Chair of Community Board 2.
All right. Hi, this is Pascual Gomez, member of the Health Committee.
Okay, next.
Hi, this is Sonia Fergus, Community Board 2 member.
Thank you, Sonia.
Jennifer Kelman, member of Community Board 2 and the Health Committee.
Thank you, Jennifer. Well,
my name is Shatori McCoy-Greg. I am a member of Community Board 2 and on the Health and Human Services Committee.
Hi, Shatori. How are you? Thank you.
How are you?
I think that's all we have that we hear. Oh, there's somebody else. No? Okay. So this is for, to give the opportunity to the two presenters know who we are and who is here. And I know, although we only see a picture, our district manager is somewhere around there, Ralph Acevedo. So,
Thank you.
And of course, Cynthia is our partner in crime in the community board too. She helps us a lot. So just moving forward, our first item in the agenda is the presentation by Epifania Adames. She's from NICA, or the Neighborhood Association for Cultural Affairs, and she will do a presentation about the services that they provide. Epifania, I'm not sure how to pronounce it, but I think it's Epifania Adames.
Sí, hi, it's Epifania. I am the Community Outreach Coordinator for Neighborhood Association for Intercultural Affairs, NICA. And what we do for the community is that we have been providing housing intervention and eviction prevention since 1974. We help thousands of families in the Bronx every year. And the way that we do that is that we provide legal services to tenants that are facing eviction in the Bronx Housing Court, and also financial assistance. In order for us to be able to assist the tenants, usually we had different standards when it comes to income and area code. However, now with the pandemic, all the standards have been lifted, and now we're just helping anyone that needs help. In order to assist, they just need to get in touch with us. I am going to leave the information on the comment section on the chat so that anyone that needs assistance can reach out to us. So what do? We provide legal services. We go to the courthouse, the Bronx Housing Court, and we represent tenants. We have a team of lawyers that are very good at what they do. For many years, we've been having a good team of lawyers that know the system very well and are able to provide legal assistance and representation, mediation. We do also case management. Every time we have a new client, we assign them a case manager. This person will make sure that they get applications for different charitable organizations that we work with. We help apply for one-shot deals, for the FEPS program, and other organizations that help us supplement any resources that are missing. For instance, if they go to Homebase and they are able to get $2,000, we can apply for other organizations that can help us supplement this in order to help fulfill the whole arrears and discontinue the cases.
Mm-hmm.
We also have our own financial assistance that we provide to further supplement in case that the tenant needs more services. We also help tenants fight their landlords with their repairs. Right now, it's more complicated to get repairs done due to social distancing, and some people do not feel comfortable having strangers in their homes, so these become cases that go to court, and we just tried our best to mediate those cases so that they have the opportunity to live in proper condition. We, as I said before, we help clients apply for the FEPS program, the STEP program, one-shot deals, the SCREE, which is a program that is helping senior citizens to freeze their rent for a period of time, and the DREAP program, which is to help that liquidity. And the income guideline, as I said before, is no longer a requirement. If a tenant makes more than the 200% poverty level, then we just send a waiver to HRA and request for HRA to allow. These waivers have been granted most of the time. The eviction moratorium right now, that was something that I wanted to touch on. Anyone that went through hardships with COVID-19 can apply for a hardship. The forms you can find provided so by the landlords as well. If a landlord sends you any documents from the courthouse to commence a case against you, they are basically also required to send a hardship form so that the tenants can obtain the help that they need, and they will be protected until May 1st if their hardship form has been approved. That is the extension of the moratorium right now. We don't know if this moratorium will be extended. However, so far, it is until May 1st that this extension has been provided. And once again, I will leave my information in the chat so that if anyone needs assistance or know anyone that needs assistance, they can reach out to me. I have my email address. I'm very responsive. I will send the information. If I cannot answer the question, if there will be sent directly to an attorney that will be reaching out. We also have a hotline number that I will also provide so that if anyone has questions about their legal case, even if they right now are not at immediate risk, they can reach out, and an attorney will contact them back if they're not able to speak with them at the moment and answer any questions that they may have. If you have any questions, I will be here, and I will be reading the chat as well and answering the questions on the chat, or if necessary,
we can have some questions now. I know, Cynthia, you were raising your hand. We can hear you, Cynthia.
Does it have to get to the point that they go to court, or can they reach out to you guys before they get sent to the court?
Right now, we are required to have at least a 14 days notice.
Okay.
Which is the first document that the landlord sends to the tenants requiring the rent.
Okay.
It's not an immediate threat to the tenants, but most landlords have been sending these already. And if the tenant has a 14-day notice, they can reach out to us and we will start the process. Also, they can reach out to us on the hotline regardless. If they have a question and they don't have the 14-day notice, if they have a question, we will be able to guide them towards the right help that they may need. Maybe we're not an organization to get involved in, and however, we may have information and help their case, and we will.
So I just have some questions. Maybe it might help the rest of the board members just to understand a little bit more about NICA, and also for me, it's going to help me. I just want to clarify: is NICA an organization? Is an organization that manages building? Is it only a community-based organization? What exactly is NICA?
It's a community-based organization.
Oh, so you don't manage buildings?
We don't.
Okay, you only work with tenants.
Yes,
around the whole Bronx. It's not specifically in one area of the Bronx.
Only the Bronx.
Okay, so I have another question. First of all, before we move forward, can you give me the hotline? Do you know the number right now?
Yes, I will get it for you right now.
Okay, and in addition to that, and I know we've been listening about this moratorium that they've been extending the moratorium because to help the people, to protect the people in their home. But
yes.
What the moratorium means is that they're not paying their rent or they're paying less of their rent. What does the moratorium entail?
The moratorium means that the tenants are protected for a period of time by either an executive order or by an executive order that has been signed by the governor, or an administrative order that has been signed by the head judges of the housing court.
But they protect it for what?
Protect them from eviction moratorium.
For eviction. Okay, so that's where I want to go. So if right now I'm on the moratorium, let's say, and I've been in the moratorium for the past 6 months, so I haven't been paying my rent in 6 months, but this is going to expire now in May. What's going to happen with those 6 months of rent? Because now I will have to start paying, and it's not going to be a month, it's going to be 6 months plus the one is coming up.
It depends on what the city decides to do. There are different organizations that are working on freezing the rent, stopping the rent. However, that has not been signed. The moratorium basically is protecting the tenants from getting evicted. The government has not signed anything stating that those 6 months, for example, that you mentioned, will be removed from your accounts.
We don't know.
You will be responsible. That's what we are assuming so far for
Yeah, because my concern is the right now, okay, it's helping me, but at the end of the whole issue, let's say May, what's going to happen with the previous 6 months? I mean, that's a question that I have, and nobody's being able to tell me.
The problem is that for that question, there is no real answer right at this moment. There is no answer that can be given to you because those are bigger questions that are not being addressed, and NICA cannot answer that, unfortunately.
And I have another question. And I'm sorry if someone else have another question, please bring it forward. So about how many clients do you have now? How many lawyers do you have working? And what is the waiting time if I just reach out to you with my problem? Because it takes time, especially if there's so much need out there. So many people, are really looking for help. And now, how you deal with, the demand versus what you can do?
We have a pretty big team of lawyers available, and during the pandemic, we also hired more lawyers, paralegals, ready to tackle the demands of new cases. And also SRA, which is the organization that manages all of the different agencies, are diligently working with every single agency that provides legal service to tenants. We are being assigned. They pretty much go through them, then come to us. Usually, however, like for instance, people that come to us from, let's say, this meeting, they come directly to us. If they get assigned also to an intake specialist, they get a case manager, and they also get their lawyers. We are now people helping them at the moment.
Okay. I'm just going to open the floor to see if any other board member has another question.
Okay.
Any other question? Okay. So you still owe me the hotline, and if you could, okay, I will write it down right now.
No, I'm going to write it on
the chat.
Okay.
Okay. All right. So if you could also send them more information, you can send it to Cynthia. Cynthia can forward it to us. And also help us to work with any community resident that may come forward with any need that they may have about the tenants issues or something like that. Thank you very much, Stephania, for being here. You always have the door open anytime you want to come back to give us an update or give us more information. You're more than welcome. Just reach out to us, and we put you in the agenda.
Yes. If you want, I can give you also. I can speak it out, the hotline number.
Yes, please.
Anyone would like to write it, would also put it in the chat. But
okay.
It's 718-538. 4830.
Okay.
I'll give you my cell phone, work cell phone number.
That's the one that you're gonna give is your work phone number?
Yes.
Yeah.
Work cell phone.
And I'm also always available there if anyone has any question. Okay.
Okay.
It's 631. 790. 6255.
6255. And you the outreach person from NICA?
I am the community outreach coordinator.
What languages do you have for interpreters?
Spanish and English so far.
Thank you.
Okay. Thank you very much. I appreciate it.
No problem.
All right.
In case any other questions?
Okay. So you're more than welcome to stay. We're going to go to the next presentation. Maybe some people might have some question and they can write it on the chat. Or, you just still can be excused after your presentation. But you're more than welcome to stay with us.
Okay.
So our next presentation is by James Hendon and Terry Holiday. They're from the New York City Department of Veteran Services. And they were going to be discussing some services that they provide for the veteran community. So who's going to talk, James or Terry?
Yeah, hi, Mr. Marrero, Terry Holiday here. I don't know if Commissioner Hendon is on the line. Is he on the line?
He's not here.
Yeah, I know. We spoke earlier. We spoke earlier today, and I told him that I would be here representing the Department of Veteran Services. So I'm almost sure he's not going to be here today, but I don't know. Let me just say thank you very much for having me. Terry Holiday. I'm a veteran. I was a former commissioner of the Mayor's Office of Veterans Affairs during the Bloomberg administration. And I've come back in a special assignment, and I'm helping the Department of Veterans Affairs reach out to the veteran service organizations throughout the city to make certain that everybody understands the services that we provide and how we can become a stronger organization and have so many things that we can do for veterans in these challenging times. Before I have to say what I have to say to you, I wanted to say that Ms. Adams for NICA, that was a marvelous presentation, and I'm going to try to link up with her because a lot of things that she talked about in the housing area sort of morphs into some of the stuff that the Department of Veterans Affairs, Veteran Services does. What I would say is that the first thing that I'd like to tell you is that we're a city organization. We're an agency. We are not the Veterans Administration. All right. So when we come on board, to do things, we are helping all veterans. If you served a day on active duty as a reservist, as a active duty, or just as a reservist, not on the type of active duty that gets your VA credit, we're there for you. As you know, there are different qualities of service. Veterans who have an honorable discharge certificate get service from the VA. They can get service from us too. But a veteran who has anything less than honorable service will not be able to be serviced by the VA. So we see a lot of people, men and women, who got general discharges, dishonorable discharges in some situations, coming to the Department of Veteran Services for assistance to move on. What we're trying to look at, what we are looking at, and I think we're doing a pretty decent job at it, and we'll keep getting better, is that now we're taking a look at food insecurity, housing insecurity, health insecurity, financial insecurity, and we're trying to find ways to assist. The food insecurity, let me go to that quick, initially. There are a lot of people who need a lot of help just to put food on the table. And since May, we've been working with HelloFresh at a food distribution center in Brooklyn, where you're packaging meals, and we're there every Wednesday. We won't have it tomorrow, but you're there packaging these meals, and the meals are getting distributed to the veteran service organizations. The veteran service organizations are then distributing these meals to their members, and in many instances, like the community. There's another one that we're doing, and this one's up in the Bronx. The money ran out for that, I think, just before New Year's. And I think we've gotten funding, and we'll pick up on that again. And we had a site at 200 West Tremont, and the trucks just pull up in the street, and we offload the trucks, and these meals are going to veterans, and they're really nice meals. Okay, it's a big box with dairy, with meat, with vegetables, Then there's a portion of it that has dry food and everything. So it's stuff that if I was in a supermarket, I'd be buying. Okay. So, we've done that, and I think we've gone from a couple of hundred meals to maybe 2,500 meals. And the trucks will come in, and we have veteran service organizations throughout the Bronx, including the VA. Okay, veteran clients who are being served by the VA, but we distribute this food to them as well too. And we were doing that from June up until just before the end of the year. And I believe the funding is now in place. I think we're going to start that again on Saturday. All right. And what happens is that we always make certain that there's something left for the community, and there may be 60, 75 people in line. Okay. So we have the numbers and stuff that we're able to service down there as well. But when we take a look at the food insecurity, we're continuing to go out as well too. Just a couple of things that we've been doing. We had this thing called Mission Vet Check. Mission Vet Check, we started this as the pandemic was really taking a hold on us. And we started an operation out of the Office of Emergency Management in Brooklyn with the National Guard. We had about 14 to 15 National Guard folks, and they were working about 6 to 7 days a week, making phone calls to veterans on lists that we were supplying to them. And we were asking them questions. How you doing? What can we do for you? Is there something that needs to be done? It might be food, might be housing, anything else along the line like that. And I believe, I don't have the figure in front of me, but there were 37 telephone calls that were made. And I think we had about 17 or 18 positive contacts. We were able to speak to the veteran's family, and some portion of that, maybe a little less than 1,000 to 1,200, needed some type of help, and we were able to provide assistance to them. So we've continued that, but not with the National Guard. We have the mayor's office has trained volunteers to make supportive buddy checks and calls to the New York veterans. So this volunteer group has been ongoing probably since about October, and they're still making these phone calls. We're still finding veterans who need some type of assistance. There's something else that we're doing in terms of veteran suicide, but this is in Staten Island, and we're beginning to take a look at it in Queens, where we want to make certain, they call it veteran mapping. And what they want to do is make certain that when we run into a situation, it's going to be mental health, okay, and it's some place along the line, and suicide enters the threat of suicide enters the picture, and it entails educating the folks who are going to be on the front lines trying to deal with this, both on the emergency services side and then into the hospitals, so that when we see them coming in. Now, Staten Island's been involved in this for maybe about 7 months, 8 months, and we're beginning to start doing that in Queens. And they just sort of like they're table testing it right now, and I think somewhere along the line the goal is to get this into all of the boroughs. And one other thing that I would leave with you, the Veterans Administration, there are a lot of folks who they're not filed with the Veterans Administration, where you're looking for a claim, either for medical assistance or in some situation you're going to get some type of a monthly annuity, based upon your disability. So you have to go to the VA to get this done. You have to go to a VA location. In some situations, you can do this online. About a year ago, April of last year, we had 7 employees of the Department of Veterans Service get trained by New York State and became accredited VA claims service representatives. So which means we have people who are actually handling claims, and they can come directly to us. And what I hope sometime is that we can bring them to you, bring them out into the community and set something up where we can get them into the system, all right, and we can begin pursuing a claim. I leave you with just one story about this. When we were doing the Operation Vet Check with the National Guard in Brooklyn, we found a veteran who was a bit difficult to deal with on the phone. And he said something to one of the young men or women that they didn't understand. So I got on the phone with him. Turns out that this guy had a VA claim that he filed soon after Operation Desert Storm in 1991. He was in the Air Force, and they had these things with the burning oil fields and stuff like that around. So he had something. He filed a claim in 1992, and it was being handled by an organization with the VA who could handle claims. And somewhere along the line, they lost the claim. So he and I had a conversation. I called some people that we dealt with in the New York State Department of Military Services. They contacted someone else, and that organization picked up the claim. The thing is, if this guy is able to get this claim, and probably, I'm going to guess he probably will, it's going to go all the way back to 1992, and that's when they're going to owe it to him. There are a lot more folks out there like that, all right, who have veteran benefits, and if they file for them, it's going to make their life a little bit easier. And in today's challenging times, every little bit helps. So if you need, let me give you my phone number, okay? My phone number is 646-951-4406. Okay, and I can be a conduit for you. I'll get you. I sent a resource page in, but I'll get some more stuff in there for you that you can take a look at, and you can take a look at the website for the Department of Veteran Services. There's one other thing that we can help out with. There were a lot of veterans who served in Vietnam, and they were generally black and Hispanic. All right, and they were. And what normally happened, the trend was, if you had somebody and they were difficult to deal with and didn't adapt to military life, okay, you either put a lot of time and effort into them, or you court-martial them, or you give them a general discharge. And it's sort of like if you saw Full Metal Jacket, the sergeant goes up to the guy who's the troublemaker and says, look, I can get you out and back on the street in Brooklyn in 3 days, but sign this form. All right. A lot of men did that. All right. Now they're in their late 60s to 70s, and they can't get VA claims. The VA can't take care of them. Okay, because they have less than an honorable discharge. What we've begun to get into now is we've got a place that's funded, that's connected to us, where we can help out in getting an upgrade of that general discharge to an honorable discharge. So that's just something that started within the last couple of months, but this is also something that we can do. So that's who we are. Just remember, we're not DVS. We're not the VA. You can give us a call and we can try to help. And that's it. Are there any questions?
Yeah, there's more services out there that sometimes we don't even realize, and it's so I guess I would say unfair that sometimes the veterans are not treated the way they should. And my dad was a veteran, so I know what I'm talking about. But I just want to ask you, by any chance, do your office has like statistic of where these veterans are living in the Bronx, like demographic information?
Yeah, well, we sort of we do have those. We do have the information, and in many respects, I think it's a ballpark number. We did something. We got our hands on some money about in September to help out these veteran service organizations that experience a loss of revenue because they couldn't rent out space in their posts and everything else. So as we reached out to them, we found out that a lot of the information that we had with these veteran service organizations, it didn't click. The organization was no longer there. And sometimes we contacted the organization and they only had 1 or 2 members. So what we're trying to do is to really upgrade that to make certain that the information that we have is accurate, And one of the things that we would ask of you, if you have any veterans on your community board, it would really be great if you could designate, a veteran to be a liaison to the Department of Veteran Services. Then this way we could, every once in a while, have conversations or that question that you just asked. We can work on it and get something a little bit more specific about it. What we also did is we sent something out to all of the veteran contacts that we had to let them know that a community board is a great place to contribute to the community, and you guys should be applying for membership and everything else. So that's what we're doing.
Yeah, actually, I can tell you that we had at one point, a committee, a veteran committee.
That's great.
It was run by a veteran. What happened is that, he was sick and he had to step out.
Right.
And we don't, I'm not sure if we have somebody. I think we do have somebody right now. But encouraging them to join the community boards is great because they can also help us, to do this liaison and link between, your organizations and our community residents who are veterans. And I was asking you about the statistics because, if we will know how many veterans live in the community board too, it will give us a better idea of what else can we do, how much can we reach to this community of veterans.
Well, I'll see if I can get that for you. Somebody may have that information. I'll get it and get it to you. I just want to let you know to make certain that the information that we have, almost like the census information, but as long as whatever information we get it's like really going to be it's going to be a ballpark figure. Whether it's a big ballpark, a small ballpark, I don't know. But I think we can sort of circle that number.
Okay. Is anybody has another question? Cruz, who will be at Cruz?
Of course. Hi. Terry, thank you so much for your service, first of all.
Thank you.
Truly appreciate it. I had a brother that was a veteran, and he died in Bronx, VA. So I had the opportunity of volunteering with what used to be the nursing home right next to the Bronx, VA. And unfortunately, that's become sort of like a short term. So veterans are no longer able to stay there and live the rest of their lives. A lot of them do need long term. What has happened to these veterans, I work in a nursing home. What has happened, can you hear me? I'm sorry. Somebody's
I can hear you. I'm just writing a note.
Okay. Oh, no, it's because somebody's not muted, so I'm getting a lot of feedback. So a lot of these veterans that were there for long term, they've winded up in nursing homes.
Right.
I work in a nursing home. We don't specialize on veterans. And sometimes my heart goes out to them because what do? On Veterans Day, we get a few flags, we pass them out. 4th of July, we get a few flags, we pass them out. But taking care of a veteran, knowing veterans, it's a lot more than that.
Yeah.
I don't have the resources. I'm a licensed social worker. I do as much as I can do, but not having the background, I always feel like I'm lacking something with them. So I offer them the usual, the emotional support, what do we do tomorrow? What are we doing today? Thank you for your service, and always praise them for what they did for our country. What in the nursing home is different because they're getting the care. What do you suggest I can go? I want to do the whole 9 yards for them. I have a handful of them. What can I do? Well,
you and I can talk offline. You have my phone number, all right? And so just give me a call. What I think, one of the things, I had a conversation with somebody, and I won't tell you which mayor it was. And it was sort of like, we have to talk about all of the great things that you do, like after you've gone, we got whatever it is. And I said, there's only one thing that makes any difference to me. Okay. This is when I knew I didn't have the job. I said, look, when I die, it's not going to say Terry Holliday, Commissioner, New York City. It's going to say Terry Holliday, Colonel, United States Air Force, and it's going to tell you a couple of things that I did. That's what's going to be on my tombstone. That's all that I care about. Now, the folks that you're dealing with, that's a very big thing for them. Okay? And don't think that your lack of service doesn't mean anything. Forget it. You're doing so. Do you know Jim Malarkey? He did a lot of stuff up at the Bronx VA and volunteer stuff.
I've heard the name.
Okay. Yeah, he just lost his son, I think, about 2 months ago. I'll talk to you. All right. Okay. But I just want to tell you, I want to tell everybody this. There's a project that we have. It's run by one of my colleagues, Greg Williams. It's called Voices of Veterans. And what he will do, he'll get people on the telephone. He's going to get your stories. He's going to do a bunch of things. And he'll have it memorialized. They just opened up a Voices of Veterans project at the Jumel Mansion on 160th Street off on Edgecombe Avenue. All right. They just opened that up about 3 days ago. And a lot of the stuff that it's Commissioner Hendon. Commissioner Hendon is he's a participating lieutenant colonel in the Army Reserve. The guy's like really good. He's a young guy. I can't keep up with him, but he just has us reaching outside to do these things. So what I need for you to do is let's touch base. I'm also a member of Kappa Alpha Psi fraternity, Divine Nine. I'm going to beat these guys into shame to help you out. Okay. They've been very good helping us out with the food programs. Okay. But I think this is something that I can really convince them that they should be doing, but we'll talk. So just give me a call when you have a moment. Okay.
Okay. And keep in mind that's where you're losing some of them. They're in nursing homes, and because they have dementia, or because they're no longer able to do for themselves, they're in nursing homes. And
but I'm going to tell you something. You put them in a little bit of an environment, and they hear the Army song and the Navy song, and do something. Well, all of a sudden, a glint's going to come in their eye. Okay, because that takes you back to when you were 18. I mean, I was doing something, we did something up in the Bronx, but we did it with the Toys for Tots program. And I had to get over to Garden City to help pick up toys and load stuff and whatever it is. This was last December. So I got there early, and I wasn't supposed to be there early. They gave me wrong information. So I'm sitting in the car. It's cold. I'm trying to maybe catch a wink or something, but I see two Marines walk past me, and they're in their dress uniform, not the dress uniform. Yeah, it's a dress uniform. They're in there with a dress uniform. I said, damn. I said, what the hell are these guys doing? But I realized they were going out to the flagpole to raise the flag, okay, because it's a ceremony. I forgot, because I'm on a military base, right off of Stewart Avenue, and the other side of the street is Roosevelt Field, right? As soon as 7 o'clock rolls, you hear a bugle. They get out. They raise the flag. I got out of my car. I'm saluting at the thing, and a chill just goes up your spine, because I've been used to doing that on bases and everything, and here I am doing this now. And I hadn't even crossed my mind. I just got out of there and did it. If you had some of those clients of yours out there at that time, now they're not going to be, but if you did, they would have had the same effect. I'm telling you. But we'll talk and we'll make something happen. Where's your nursing home?
On Intervale Avenue.
Okay. All right. We'll get together.
Yeah.
Lucy, I'm sorry I'm taking up all of your time.
No, thank you. I really
appreciate it, and I could listen to you forever. Thank you.
No, you probably would. I'll speak to you.
Question?
Yes, Victoria.
Okay. So my question is, I noticed that you mentioned about your assistance with food insecurities and housing. I would like to know if part of your assistance is helping veterans ascertain resources for medical care, especially along the lines that Julia was saying, with nursing homes. Also, do you help connect veterans to like day programs, and helping them work with insurance companies, because there are a lot of veterans who do not qualify for VA benefits, and they're kind of like in limbo that they don't qualify for Medicaid, or they do qualify for Medicaid and Medicare, or may not qualify for Medicare because they don't have enough credit. So do you help them with medical concerns?
We help them where we can, okay? But I think, now I don't do this, okay? We have some folks, we have peer coordinators with housing, with health services and stuff like that. And a lot of it I'm finding is that we coordinate a lot of these things that we do, all right? So if we're servicing somebody, we get them, we enter them into the system that connects them to a lot of these other services that are out there, okay? And we coordinate that, all right? And so once we hit a point, if it's something that's not within our sphere, we make sure to get to somebody who does do that. Now, I can put you in contact with people that specifically do that, okay? They specifically do that. And so you've got my number too, right? Okay, so you just call me, okay? You call me and I'll make the calls and we'll do one thing. There's one other thing that we do that you guys can help us out with. We have a program for burying veterans who have no assets and no families. It's an unclaimed burial program. And it's really, we're having a tough time with it now because of COVID starting to make that climb upwards and stuff. But we're doing the stuff with the city. What we want to make certain is that if a veteran is an honorably discharged veteran, that they are buried out at Calverton with final military honors. And that means you got two uniformed members of the military. At least one is from their branch of service. All right. Somebody's playing taps, either real taps or on a fake thing, and they get a flag over the coffin. That's called final military honors. Most veterans are very happy if they get that. You know, so if you know a veteran, if that veteran is honorably discharged, you need to make certain that they have that done. Okay, and if they're treated in the VA, you know that they're honorably discharged and the papers are there. If not, you can reserve a place in a national cemetery. I have. People thought I was crazy about it. But what I did is I took this reservation form, I put my DD Form 214s with it, discharge certificates, and my retirement order with it. And I mailed it off. So they sent it back to me. So I have something with all of the papers that when I go, but I'm a Yankee fan, so I want to live forever, okay, that somebody can put their hands on it and say, okay, this is what he wanted, and this is where it's, and they know the stuff is there, like a will or an estate plan or something like that. But that's, and I'll get that form and get that out to you too. But they're like a lot of things. So we have to talk, and Shatoria, we have to talk. I'm taking up all your time.
May I say something?
Thank you very much.
Wanted to.
May I say something?
I'm sorry.
Hello?
Ralph? Sorry.
No, this is Raymond.
Oh, yes.
Hey, this is to, I guess, Louis or maybe Ralph. If you guys need a liaison for this, I'd volunteer. I've actually used to attend the previous veteran meetings. I'm a veteran myself, a sergeant. I'm familiar with the compensation programs and a lot of the services that are offered to the VA. So if the board needs a liaison, you can throw my name in the hat if you need. I'll be more than happy to do it.
Thank you, Raymond. That would be good.
What branch?
Army. Yeah, I did a tour in Iraq and came back and I got out. So I'm very familiar with a lot of the programs and the paperwork and a lot of the ceremonies.
Yeah.
And just like you, I miss it. So I get it. I totally get it.
I tell you, like I did. I remember a tour that I did over in Huntington at RAF Alconbury, and every morning it was like you get out, they play the national anthem, and then they play God Save the Queen. For some reason I always remember that. So thank you for your service.
Thank you.
Thank you, Jennifer. You have the last question.
Hi. It's not of a question. It's more of a way to see if maybe we can work together. I run a day program in the Bronx. We have tried to work with veterans. Although right now we're closed for in-person services, we're doing telehealth, and we provide meals if they qualify for a program. Is it something that maybe you would be interested in working to see if, the veterans would qualify and we can work together? And then obviously once we are allowed to resume in-person services, they will be able to come into the center. We have an 8,000 square foot facility. We've been around for about 8.5 years.
Can I contact you with Letitia Russo? Okay. I'll give you her phone number on the chat. Okay, Jennifer? And you have my number. I'd love to work with you guys.
Okay, great.
Oh, Terry, you've done a lot of network here.
Yeah. Well, I got to tell you something. From the beginning till now, all we're doing is talking about stuff that I'm involved in, and that we're all involved in, and and I think that and we're working with community stuff. If we all coordinate stuff and we all work, we're doing it. No, I'm enjoying this. Thank you very much.
Thank you for coming. Thank you for your presentation. Excellent presentation.
Okay, thank you so much.
Okay, and you can stay if you want. I mean, we're almost done. Now we haven't, and I know she's in the phone, Anita from DOH, and I would like to have like an update, if she's good, about COVID and what's going on with COVID in New York City. Anita, are you there?
She's there. Hold on, give her a second.
Okay.
And sorry. I have a few slides and I'm going to go through them very quickly because I want to let everyone know what's happening. So my name is Anita Reyes, and I'm the Acting Assistant Commissioner for the Bureau of the Bronx Neighborhood Health. And my work really entails partnering with everyone, but currently it's everything about COVID. And so it's really important for you to understand what's happening with COVID. And so I got a quick map to show you. We are continuing to see the numbers go up, the number of cases in the Bronx. If you notice where the dark, can everyone see the screen?
Yes.
Okay. Where you see the dark colors, that means that's where the highest number of cases are. So if you see in the Hunts Point area, we're seeing it's right now in the last 7 days been the highest number of cases. So that's not good. And then which is like 14%. And we've also seen that in the Longwood area, 10,459, it's about 10%. So yes, we're seeing the Bronx is really being hard. This is our landing page, and it shows you what's happened. And if you see, we're seeing the numbers going up. And we do know that because of the holidays, because of people traveling and all these different congregation patterns, then the numbers have been going up. So that's not a good sign, because when we see the numbers go up, we're seeing the number of hospitalizations go up and the number of deaths. So in the city, the number of cases is 8.23, and the number of cases that we've seen confirmed death is 361. So again, every time we see increases, it's increasing everywhere. So for the Bronx, I wanted to give you a quick snapshot of what we're seeing. We continue to see the numbers higher than the rest of the city. Okay, so we're at 9.89. compared to New York City, citywide is 7.79. Quickly with that, I just wanted to mention about the new variant. We've seen cases in New York State and in New York City. We know that this variant is not more transmissible than COVID-19. So it is transmitted from person to person. It is appearing to be more transmissible from person to person. But currently, there's no evidence that it causes more severe illness or that there's evidence that there's a resistance with the new vaccine. I also want to make sure that people know the 4 core. We have to continue wearing the mask. We have to try social distancing, 6 feet, as well as washing hands and staying home. If someone is sick, just stay home and avoiding all the travel and gatherings. For the elderly people, we're asking them to stay home unless they have an appointment that they have to go out. In terms of the vaccine, we have a new vaccine command center for the New York City Department of Operations, where we're working together with the state and federal partners to make sure that we're looking at the priority list, but also to make sure we have an equitable distribution. We're partnering with many city council folks and elected officials, but also community partners in the area. So what is this vaccine command center? Basically what it is a place where we're coordinating all the efforts with different city agencies as to how to distribute the vaccine. We are working on a comprehensive community engagement plan and outreach plan that really emphasizes equity, because we have seen that the numbers in the neighborhoods that, in the low-income neighborhoods or neighborhoods with Latinos and Blacks, that's where we're seeing the most impact of COVID. If you look at our landing page, you'll see that we have data in terms of how many people we've vaccinated. And so far, we've vaccinated over 800,000 people. And if you've looked at the recent data, it shows that, Black and Latinos are, getting their vaccines, but at a low rate. Okay. In terms of the key things that we're doing, I don't like to say educate. The slide says educate, but it's more like inform New Yorkers with science-based information so that we could prevent this misinformation that's out there. And so how are we prioritizing? We're making sure that we're focusing on the timeline that CDC and the governor has put out. So prioritizing groups like healthcare workers, people 65 and older, essential workers, such as the, first responders. But today I just saw that it includes supermarkets, but also restaurants. So they're expanding the list. And then when will vaccine be available? Right now it's limited. We don't have that many. There's a high demand and a low supply. And what we're asking New Yorkers is to please wait for their turns to go and get vaccinated, because if you're not eligible, you cannot be accepted to get your vaccine. So the phased approach that we have right now, we're not expecting for it to get everyone vaccinated until mid-2021, so around spring or summertime. Okay? Mm-hmm. And that's it, I think. I think, we have a landing page that really has a lot more information than what I said. If you're looking for a place to get vaccinated, you can either call or go to the vaccine lander page.
Okay. Thank you, Anita. I just have two questions. I know the vaccines are limited, but I haven't heard, I haven't seen the news today, but I haven't heard that this week they're assigning new vaccines to New York. What I'm listening is the second shot, but what about the first shot for people? Are we still getting the vaccine this week, or is going to be next week, or have you heard anything?
Yeah, so the Department of Health is going to have some sites that are only going to focus on dose 2, and then there's going to be a few sites that are going to focus on dose 1. And so, I think in terms of distribution and what we're getting, I'm not sure, because again, that's coming from the federal government, but we do know that there's been a shortage. where we're not getting enough supply.
And yeah, I know about the not enough, but when all of a sudden we got those 1 million doses, there was a lot of fuss about it. But now I haven't heard anything else. So I was curious because I haven't heard anything, and I thought that you may know something. And another question that I have, that there's a lot of concern about people getting the vaccine because the statistics says that more white people are getting the vaccine more than people of color, let's say black and brown or Hispanic. Do the city of New York have the map of where by borough? Do you have the statistic by borough where these vaccines are going? Because I'm curious to see, let's say in the Bronx and Community Board 2, how many did we get in the Community Board 2? Just pop up to my mind. Or how many are we getting in the Bronx? How many are we getting in Manhattan? Do you have that statistics?
Yeah, Louis, that's a great question, and we don't have that information yet, but we're working towards getting that information. It's just the same thing as the information around race. We haven't really gotten the full picture. We just have some of it because remember, we have to collect this information from different sites and everyone collects it in a different way. So we're not there yet, but we're hoping that we could get to that end.
And another question that I have, and I don't know if you know what's the process to, because just to get a vaccine, it may take 5 seconds. But for you to get that vaccine, you have to go through a whole freaking process. You have to go online. Sometimes we have elderly people, which we do, that they're not really computer savvy. They don't know how to do it. Some people have to help them. So the whole process, it takes even longer. And I just wonder why I do get that the Department of Health wants to get the data. But at what level can we get the data after the vaccine before? It's so much that these elderly people are going through, and in addition to that, it's all the support that centers and location have to get in order to help the people to get into the system and online, because you can't even print the sheet. You have to fill out all the information online.
Right. Yep. We are hearing all the concerns, Louis, and yes, the city is looking into seeing how we could address this. Yes, we did think it was a simple process, right? Where it was just like you look for the location, then you register, or you could call online. But the demand is so hard or so high that it's been hard for people to get an appointment. So definitely we hear you. We're trying to work out something. Because we do want to make sure that we reach the population that needs this the most. So in the meantime, we do have the health department is working with a couple of CBOs in the area to see if we could pilot something that maybe the CBO can help register people to get vaccinated. And we're trying to have more points of dispensing sites throughout the Bronx and other neighborhoods. So right now, I think we have 15 of those. And, those are mass distribution sites of vaccine.
Mm-hmm, mm-hmm. Okay.
I have a question. Can I ask a question?
Sure, Julia. You can.
Of course. Me again. Other than, the questions we've been asking, are we keeping track of when people are offered and they refuse and they reject? I think that statistic is high amongst us.
Yes.
For that question, we have done polls and surveys, and there's information out there, and we've seen that, there's a concern around that. But in terms of us collecting like everyone who refused, I don't know about that. I do know that there are surveys that have been done and polls that show that there's people that are more leery. I mean, I recently participated in a focus group, and there was a lot of concern. I did see a lot of the people in the room were not comfortable. So again, I think it's going to take all of us to work on how we're messaging, not just the city, it's all of us. And the more I'm working at a 24-hour site in Manhattan, and I tell people you have to promote it. You have to talk to your family, tell them how you felt after you received the vaccine. So this is going to be a community effort.
Yeah.
Or the vaccine. I mean, you can bring the whole shipment here, but if people are still resisting and not taking it, because I've encountered some people, and I mean, they literally argued with me, oh, you just want to kill me? And I don't know where they're getting this information, but we need to be very careful on how we express ourselves and how we go forth from here. So that's something good to start getting numbers on.
Right.
I can invite you all to participate in like a community organizations, train the trainer, so that you could be trained on these key messages, because the same questions continue to come up. So I will invite the whole team that's here and other people to be part of these conversations. We're doing it twice a week.
Absolutely.
Can we get this presentation, please?
Yes, I'm happy to share this presentation with you all.
Thank you.
Thank you, Anita.
This is Sonia. Ask one question. Is there any indication why is it so high, Hunts Point and Longwood Avenue? Why is the percentage of COVID-19 so high? Is it because we're not protecting ourselves? We're in our masks? We're doing too much social gathering? Why is it
all
so
that. It's a combination.
That, right?
I think, I mean, like if you look around, I've been in the neighborhood and I've been distributing PPEs, and, you know, we see some people with it, but there's others that don't want it, and there's others that are not listening to the protocol. I mean, I have to say that it's hard, right? Because when you want to be with your family, your friends, especially during the holidays, then you're traveling. I mean, you saw the airports around the holidays. Everybody was traveling. Or not everybody, but I'm saying, you know, many people were traveling.
Yeah. But Anita.
Oh, yeah, I think also we have large families, and if you look especially Latino families, and I think also the African American, we tend to have a lot of families live with us. And remember, if you have 5 family members living with you, they come in communication with how many people a day. So you're bringing all that home. So I think we tend to spread it amongst ourselves, and we're not doing too much to protect ourselves. So there's a lot of reasons. We just got to keep educating and keep talking to people.
Yeah. Thank you. Any other question before we move forward? Thank you, Anita. I know somebody asked if you can share the presentation. I know we have it, and it will be part of the minute, so you'll get it anyway. Just moving forward, any old business that we need to address?
No, but if you scroll past the agenda, there's a couple of things there.
Oh, I don't have. I only have the agenda, but I don't have the online agenda. But I can tell you that in terms of new business. Oh, right there. Can you move it down? That's only one page.
There you go.
Oh, I was gonna say that. But for announcements. But any new business before we move to announcements?
This is Raymond again.
Okay, Raymond.
So I just wanted to let you guys know that I actually met with the city. For those that don't know me, I'm the manager of the Banknote building on the other side of the Bruckner.
Oh.
So I met with the city of New York on Thursday of last week, as using the the vacant HRA offices that are closed right now, as a vaccination site. So I did everything in my power to entice them. As the landlord, we also offered to contribute in any way we could. So crossing our fingers, if I hear more information, I'll let Ralph know, and you can pass it on to the committee. But we would hope to. Our location is so large that we could have a massive vaccination site if we're able to.
Thank you. Anita, you're hearing that too, right? That's good to know. Yes. Thank you.
I'm hearing that, and if you send me an email, I'll also elevate that.
Okay.
Oh, Raymond. For announcement, so as you know, as you may know, every year we celebrate the Wear Red Day, and basically Wear Red Day is to create awareness about the cardiovascular conditions, specifically in women, and they do it at the first Friday of each February. So it will be this Friday, and you have some information on the screen right now. If you could, if you're going to be outside, you can wear red just to create that awareness. In addition to that, you have two information there. There's going to be some workshops that you can join. And I think I sent this information already via email. So if you want to, log in and get some information about it, it will be really nice. Any other announcement? Oh, construction project. That's too small. I can't read it. Can you read it?
I'll read it. It says construction project, a single lane restriction westbound Bruckner Boulevard between Bronx River Avenue and Whitlock Avenue in the Bronx. On or about Friday, January 29th at 5 a.m. through Monday, March 15th at 5 a.m. The New York State Department of Transportation is advising the public that westbound Bruckner Boulevard between Bronx River Avenue and Whitlock will be restricted to a one lane through the work zone on or about Friday at 5 a.m. through Monday, March 15th at 5 a.m.
All right.
For the work zone, the right lane from Bruckner Expressway will be a dedicated exit lane for Bruckner Boulevard traffic. After the work zone, there will be an additional exit from the westbound Bruckner Expressway to westbound Bruckner Boulevard. I can send this to you. We just wanted to give you a heads up. Under the train is going to be a little hectic.
Yeah.
For about 2 months.
Oh wow. Thank you, Cynthia. Yes, please. Can you send it to all of us?
I'll send this agenda to everyone because I know I didn't send the agenda out. So I'll send all of this information to everyone.
Near Yankee. What is this? New York Yankee Community Council Youth Leadership.
Yes, every year we get the okay. We just got the okay yesterday from the Yankees, and they give us a New York Yankee Community Council Youth Leadership Award. So what we normally do is look for for youth who volunteer, do community service in our area, or they live in our area and volunteer somewhere else. And the description is in the memo saying that they have to have at least 50 hours, and we need a resume, and we need someone to nominate them. So it goes back through the community board. Then Julia could actually tell you more about this.
All right. So basically, if you have anyone, okay, go ahead.
It's just real quick. It's a committee that we set up, and we receive the resumes, and we receive them, whether it's 20 of them, whether it's 5 of them. We look at each of them, and each committee member, I usually have about 3, including myself. We vote on, is this a person that actually did the work? Is this a person, because there's a difference between actually volunteering from the heart or just saying that, you did something out of obligation. So we weed out, and all of them are fantastic, but we pick out, about 5 of them, and each of them gets $750, which they can use towards their books, towards their study. So these are special kids that we reward with the $750. So last year we had great resumes. I kept a copy of a couple, and I read them every time I need some kind of incentive. Kids are out there doing it, so let's find those kids. And the sad part about it is that we don't receive that many. There's so many kids doing things. Be creative and get us those write-ups, because to get 3 and we have to keep forcing to get more, it's $750. Somebody can use that money. Those kids can use that money, and they're there. So anybody who deals with kids, anybody that has neighbors that are kids, see if they do anything special and just have them join this, and we will definitely pick the kids that actually do the work. So as soon as possible.
How old they have to be? What's the age range?
They changed everything up this year due to COVID. So I will send everything out, and then we can go from there.
And the deadline.
The best part about the way that Julia and the committee picks the children, we white out the names and the organizations because we're pretty sure that we would probably know a few of them that get nominated. So we immediately white out the information of the name and the organization.
Yeah, I never knew who was that person. Who was it? Who did that person belong to? We didn't know anything about them, just what they had written and just what they volunteered doing. But most of the time, I would stick around being teenagers, maybe 12 or so. But if you know anybody like that, start encouraging them, and then we'll give you the ages also, so we could be sure.
Yeah, so just have them start writing up a resume or a little notice about themselves and how community service affects their life.
Okay. All right. Thank you.
Thank you.
But I will send all of this in the email as soon as we get off the call.
Sure.
Okay.
So you have something else there, right, Cynthia?
No,
that's the last. That's it?
Yeah, that's it.
All right. So there's no more announcement. I just ask for a motion to adjourn the meeting at 6:21.
I'm sorry.
Oh, go ahead.
Sorry, Liz.
Okay.
I wanted to ask on the status of the aging subcommittee that we last spoke about. Is it happening?
Ralph?
Aware of, I know that the chairman mentioned that. So Jennifer, when you get a chance, follow up with the chairman. If you want, I'll reach out to him and let him know. He was all about it.
I'll be in the Bronx tomorrow, so I'll give him a call. Thank you.
Hey, sounds good.
Yeah, I think he wants to go ahead with it, Jennifer. The only thing I think because of all the stuff how we're doing it, it's gotten impossible. But I think he does want to go ahead, so try to get something going because I know you're really interested in that.
Yeah, he's been for a couple of years wanting to do a committee on aging. So it's not something, he's been maybe 2 or 3 years when we had, or like 2 retreats ago, he had mentioned it also then. So, I can follow up with him also.
Thank you. All right. So if there's nothing else, a motion to adjourn the meeting? Motion.
Yeah.
So that's the motion?
Sonia.
Sonia. Okay, Sonia. Thank you. Have a good night. Thank you for being here.
Everyone, I'm going to stop the recording now, Louis.
And looking forward to see you at the full board meeting at the end of the month.
Okay.
Good night, everyone.
Good night.
Bye.
Bye.